In this video, I am discussing about failure to thrive, faltering growth. That is, how can we analyze this if the chief complaints is failure to thrive, child is not growing well, my child. So first, as usual, onset, course and durations. What make it better and what make it worse? Then early. What is early? First of all, the losses we understand. First, early is appetite. Is that he is losing his appetite right now, not taking food properly? Then the losses. What are the losses like vomiting? Can be diarrhea. If diarrhea, chief complaints, or if diarrhea anyone tell, then 5 FS to analyze this diarrhea. These are frequency of the loose motions. Is it associated with the fever? Food content present on the loose motions. Is it foul smelling? Flush difficulty. So we know that flush difficulty is celiac disease. Then evidence. E for evidence, like how did you notice it? Clothes, loose clothes, do you measure the weight and pierce like that? Plus growth chart. Have you growth chart of this child? So again I am repeating, the chief complaints is failure to thrive or faltering growth. The child is not growing well. Then first we analyze this onset, course and durations. What make it better and what make it worse, and early. Early, A for appetite, L for losses and E for evidence. So A for appetite, that is the child appetite, how we ask in diet history. Then losses are like vomiting, is that any vomiting present or not? Diarrhea, if diarrhea, we ask about 5 FS, like the frequency of the loose motions, fever, food content present or not, foul smelling, the stool, and the flush difficulty, the poo. Then evidence, like how can you know that he is losing weight or he's not growing well? Like how did you notice it? Clothes, like loose clothes, weight is decreasing, peers. Plus growth chart is available or not. Now the differential diagnosis of faltering growth. So when the chief complains faltering growth in history, we make a list of differential diagnosis, and by that we can easily go the diagnosis. First of all, decrease intake, like neglect case, severe fussy eater. So mother can give you the history like neglect, anything that mother is busy, she is busy on work, can't see the child properly. Severe fussy eater, like the child can't eat, he is cannot want to eat. Then increased loss, like parasite infection, repeated gastroenteritis. So repeated any gastroenteritis, so we can understand that is increased loss. Plus increased needs, like chronic any illness as cystic fibrosis, any chronic illness. So faltering growth can be reached the diagnosis cystic fibrosis because chronic illness child. Then malabsorption, any syndrome present, celiac disease, cystic fibrosis and giardiasis. Celiac disease, cystic fibrosis commonly come on exams. Sometimes faltering growth also associated with some syndrome, we keep in mind. So these are the DD of faltering growth. Number 1 is decrease intake, that is neglect or severe fussy eater. Number 2 is increased loss, parasite or repeated gastroenteritis history. Number 3 is increased needs, that means chronic any illness as cystic fibrosis, malabsorptions like celiac disease, cystic fibrosis and giardiasis. Thank you.